And we start in Maryland with an update to our continuing coverage of the heroin and opioid crisis. Today, Governor Larry Hogan announced millions in funding to support the fight against addiction. 47 ABC's David Caldwell has been looking into the numbers as well as the plans and joins us now live in the studio with more on this. David?
That's right, Emily. $3 million in state grant funding. It will go toward two main efforts, one focusing on getting law enforcement agencies across the whole state working together against drug trafficking, and the other focusing on treatment of individual people addicted to drugs.
We're rewriting the book on how to treat opiate use with new methods, new concepts.
Among the concepts Dr. Michael Finnegan is talking about is the Safe Streets Initiative, which connects repeat drug offenders who are struggling with addiction with drug treatment services. It's one of two programs being funded by state grant money announced by Governor Larry Hogan's office Monday. It calls for the Safe Streets model to integrate a peer recovery specialist program, getting addicts who are in recovery to help coach those working toward recovery.
Individuals that can walk a path with another addict, somebody who has come out the other side and has a year of sobriety and of abstinence, a change in their lifestyle, is partnered with an individual who is currently in the throes of addiction, struggling to regain their life.
It's another example of a radical shift in addiction treatment, says Finnegan, who is a member of the governor's Heroin and Opioid Emergency Task Force. The shift focuses on treating addiction as a disease and getting law enforcement, healthcare providers, and faith-based groups working together to get drug offenders into care, not just jail. The funding announced Monday for the 2017 fiscal year includes over $164,000 in Safe Streets money for the Dorchester Community Partnership and nearly $248,000 for the Salisbury Police Department. Salisbury Police Chief Barbara Duncan tells 47 ABC she's especially excited about the Peer Recovery Specialist Program. It will operate through the Wicomico County Health Department, which currently has 2 specialists on staff and will be getting a third. She says the funding also includes group therapy for the family members of recovering addicts. The funding stream also aims to coordinate drug data across jurisdictions. So, for example, drug trafficking data from Worcester County will be shared in a central database to make it easier to identify drug traffickers in Talbot County and statewide, part of what Dr. Finnegan calls a balanced approach.
At the same time, the governor is very focused on harm reduction. We need to stop the deaths. 79 people every day in the United States is dying from an opiate overdose.
Now, there are 17 counties receiving funding for the Heroin Data Coordination Program in Maryland, including Dorchester, Talbot, Wicomico, and Worcester. The governor's office tells 47 ABC that Somerset County did not apply. Now, we're still waiting to hear back from county commissioners there as to why that may be the case.